My name is Dr. Brownhilda Santo. I'm a triple board certified physician in internal medicine, pulmonary medicine, and critical care medicine. I went to medical school in a few places. I started at the University of Bologna in Italy, continued at Spartan Health Medical Science University in St. Lucia. I did my residency and my fellowship at Wayne State University, Detroit Medical Center. And after that, I've been in the area practicing since 2014. I think medicine should be a calling. You should be ready to serve. I know it can be lucrative, but I think if you look at it as a profession where you're called to serve others and to make a difference in somebody's life, to be impactful in people's life, then you'll enjoy the field of medicine. So as a pulmonologist, a lot of people think of pulmonary medicine as just COPD, but there is more to that. You could have interstitial lung disease. You could have even, we work hand in hand with lung cancer patients. You could have asthma patients, sarcoidosis, and many others. So we generally work with the lung health, so anything that has to do with the lungs. As a critical care physician, we're generally like internal medicine, but with very sick patients. So we take care of the sickest patients in the hospital. A quick action could actually be the difference between that patient living or dying. So my job involves, it can be really a very high intensive job, but pulmonary and critical care, I think it's a very pivotal branch of medicine. As a pulmonologist and critical care physician, I do a few procedures. In the ICU, I do intubations, central line placement, arterial line placement, lumbar puncture, chest tube placement, bronchoscopies, and as a pulmonologist, I do pleurex catheters, which help patients with recurrent pleural effusions. I also do endobronchial ultrasound, which we call EBUS, and I will be doing navigational bronchoscopy. I think I would say incorporate exercise and healthy dieting. I actually love music. I love to dance. I love to listen to music. I feel like music is therapy, especially if it's music that you like, and it could be any music. I also like to travel. So I like to meet new people. I like to learn new cultures. So those are some of the things that I love doing. So I feel like you should look at every patient like your family. If you do that, you never get wrong, you never go wrong. So generally, when I meet a patient for the first time, I want to put myself in that patient's place. What would I do if this was me in that sickbed? You have to always try to remember that you are dealing with other people who have emotions. And if you look at that patient like your dad, your mom, your siblings, your children, your family, then that is already, I think, 50% of helping that patient to heal. I also believe in making that patient understand their disease process, explaining to that patient what I'm doing. And also, if the patient is unable to assist or understand what's going on, especially when I'm in the ICU, communicating with the family, with loved ones, is also very important, because sometimes the loved ones are the ones actually going through a lot of emotions more than even the patient, especially if the patient cannot even comprehend what's going on.